हेलो एवरीवन, सो वेलकम बैक टू आवर चैनल नर्सिंग की। कल हमने मस्कुलोस्केलेटल सिस्टम के कुछ एमसीक्यूज डिस्कस किए थे, जो कि हम आज भी रिमेनिंग क्वेश्चंस जो बचे थे उनको डिस्कस करेंगे। तो अब स्टार्ट करते हैं क्वेश्चन से। नर्स बर्लिंडा इज असाइंड टू अ 41-year-old client who has a diagnosis of chronic pancreatitis. The nurse reviews the laboratory result, anticipating a laboratory report that indicates a serum amylase level of A. 45 units per liter, B. 100 units per liter, C. 300 units per liter, and D. 500 units per liter. So correct option is C. 300 units per liter. The normal serum amylase level is 25 to 151 units per liter. With chronic cases of pancreatitis, the rise in serum amylase level usually does not exceed 3 times the normal value. In acute pancreatitis, the value may exceed 5 times to the normal. Basic lab studies for chronic pancreatitis can include A. CBC, BMP, LFTs, lipase amylase, lipid panel, and a fecal lactase. One value, lipase and amylase levels can be elevated, but they are usually normal secondary to significant pancreatic scarring and fibrosis. Next question is, what type of tissue is cartilage? Muscular, B. epithelial, C. connective, D. nervous. Correct option is C. connective tissue. The skeletal system is made of bones and cartilages. Both bones and cartilages are specialized connective tissue. Cartilages have slightly pliable matrix, unlike bones, which possess a hard matrix. Next question is, which of these is not a function of the skeletal system? A. mineral storage, B. protection of organs, C. movement, D. metabolism. So correct option is D. metabolism. The skeletal system is made of bones and cartilages. The skeletal system has several important functions, which include storage of mineral, protection of vital organs, and movements. So these are the function of the skeletal system, but the metabolism is not a function of skeletal system. So correct option is D. metabolism. The presence of what makes the matrix of bones hard? A. phosphate salt, B. chondroitin salt, C. calcium salts, D. sodium salts. So correct option is C. The bones and cartilages that makes up our skeleton system are specialized connective tissue. The matrix of bones is hard due to the presence of calcium salt, while that of cartilage is slightly pliable. So next is very basic question. How many bones do we have? A273, D270, C206 and D201. So correct option is C, 206. The human body has 206 bones. However, at birth, the human body possesses 270 bones. As we grow up, some of the bones fuse together, and hence the number of bones decreases from 270 to 206. Next question is, which of these bones are not a part of axial skeleton? A. clavicle, B. skull, C. sternum, D. ribs. So correct option is A. clavicle. The bones of the skeleton system are divided into two parts. First one is axial skeleton and second one is appendicular skeleton. The skull, sternum, vertebra column and ribs make up the axial skeleton of the body. Next question is, what is the shape of hyoid bone? A. S shape, B. L shape, C. U shape and D. C shape. So correct answer is C. U shape. The hyoid bone is a U-shaped bone which is located at the base of the buccal cavity. It is a single bone and is included along with the bones of the skull. The skull possesses a total of 22 bones. Next question is, how many occipital condyles do human possesses? A. 4, B. 1, C. 3, D. 2. Option D is the correct answer. Human possesses 2 occipital condyles. Hence, human have a dicondylic skull. The function of the occipital condyle is to articulate the skull region with the superior region of the vertebral column. Next question is, what is the central hollow portion of each vertebra known as A. spinal canal, B. vertebral canal, C. neural canal, D. axial canal. Correct option is C. neural canal. Human possesses 26 vertebrae in the vertebral column. The central hollow portion of each vertebra of the vertebral column is known as the neural canal. The spinal cord passes through the neural canal. Next question is, which vertebra articulates with the occipital condyles? A. atlas, B. axis, C. sacral vertebra, D. coccygeal vertebra. So correct option is A. atlas. Humans possesses two occipital condyles. The function of the occipital condyles is to articulate the skull region with the first vertebra of the vertebral column, which is known as atlas. Next question is, the inferior alveolar nerve exits through what opening in the skull? A. the mental foramen, B. the foramen rotundum, C. the supraorbital foramen, D. the greater palatine foramen. So correct option is A. The inferior alveolar nerve exits through the mental foramina of the chin. This nerve is a branch of the mandibular nerve and supplies sensory innervation to the lower teeth. The foramen rotundum transmits the maxillary nerve. The supraorbital foramen transmits the supraorbitary artery, vein and the nerve. The greater palatine foramen is located in the palatine bone and transmits the greater palatine nerve, artery and vein. Next question is, what is the large fan-like ridge of bone that can be palpated just below the waist? A. the iliac crest, B. the anterior superior iliac spine, C. the anterior inferior iliac spine, D. the greater sciatic notch. Correct option is A. iliac crest. The large fan-like ridge of bone that can be felt just under the waist is the iliac crest. Anterior superior iliac spine and the anterior inferior iliac spine are smaller protuberance on the ilium that are important landmark for assessing malposition of the bones of the sacroiliac joints. The greater sciatic notch is in the posterior ilium and serve as a passage for several muscles and nerves of the pelvic girdle. Next question is, the head of the femur rests in what bony feature of the pelvis? A. the acetabulum, B. the obturator foramen, C. the pubic tubercle, D. the pubic symphysis. Option A is the correct option, the acetabulum. The head of the femur rests in the acetabulum, a bony socket on the lateral pelvis that is found by three bones of the innominate bone, that is the ischium, ilium and the pubis. The pubic symphysis is a midline cartilaginous joint. The obturator foramen is an opening in innominate through which multiple nerves and vessels passes. The pubic tubercle is a bony projection on the pubic that serves as an attachment point for inguinal ligaments. Next question is, what bone of the foot forms the heel? A. the navicular, B. the talus, C. the cuboid, D. the calcaneus. Option D, the calcaneus is the correct option. All of the bones listed form the posterior portion of the foot. The largest bone in the foot is the calcaneus. It forms the heel and articulates with the bones of the ankle. Next question is, what is the name for the bones that form the anterior portion of the foot but not the toes? A. the metacarpal, B. the metatarsal, C. the phalanges, D. the carpals. Option B, the metatarsal is the correct option. The bones that forms the anterior half of the foot but not the toes are the metatarsals. These are mirrored in the metacarpal bones of the hand. The carpal bones form the wrist and the phalanges form the toes and the fingers. So that's all about the today's question.